Triage is the process of rapidly assessing injured or ill patients and assigning them a priority for receiving emergency care or transportation. These icons represent the individual steps for triage. Pay special attention to them. Take body substance isolation precautions. Prior to performing the procedure, take and verbalize body substance isolation precautions and quickly put on protective gloves. Assess the situation. Before treating and transporting the patients, you must first assess the situation. While assessing the situation, keep in mind the primary goals of triage. Assess and classify the patients for the most efficient use of medical personnel and supplies. Assess the environment situation by first being sure that the area is secure for treatment. A triage supervisor is responsible for assigning available personnel and equipment to patients. Prioritize patients. Establish priorities for treatment by assessing the patients one by one. Assess the patients in the order in which they are encountered. The patient closest to you should be the first patient that you assess. As you encounter each patient, classify the patient into one of 4 groups. Priority 1. Critical, life-threatening illness or injuries that involve breathing difficulties, uncontrolled hemorrhage, altered mental status, shock, or extensive burns. Priority 2. Serious but not life-threatening illness or injuries that involve burns without airway problems, multiple or serious bone and joint injuries, as well as back injuries that do not involve damage to the spinal cord. Priority 3. Walking wounded, or patients with minor soft tissue or musculoskeletal injuries. Priority 4. Often called Priority 0, are critically injured to the point that only complicated treatment can improve life expectancy. Examples of this are patients that have massive head injuries, signs of impending death, or they have no vital signs or signs of life. Provide ongoing supportive care if the time and conditions permit. The triage decision-making algorithm chart summarizes the thought process for establishing priorities of treatment. Note: use the triage model according to your local protocols. When assessing patients, you may also follow the START, simple, triage, and rapid treatment method. First, using verbal instructions, direct the walking wounded to safe areas for detailed assessment and treatment. These patients are categorized as Priority 3, or green. Next, go to the nearest victim and assess the patient's respirations, pulse, and mental status, commonly referred to as RPM. Treatment during the START triage is limited to opening an airway, applying direct pressure to a bleeding wound, and elevating an extremity. If you encounter a patient that is not breathing, attempt to open the airway one time. If the patient remains in respiratory arrest, they are to be classified as a Priority 0 or black. If the patient spontaneously starts breathing, or if the patient has greater than 30 respirations per minute, they are to be classified as priority 1 or red. If the patient is breathing less than 30 times a minute, proceed to the next step in the assessment process, pulse. Check for either of these conditions, a radial pulse or a capillary refill of less than 2 seconds. If there is no radial pulse or capillary refill is delayed, classify the patient as priority 1 or red. If the patient has a pulse and the capillary refill is less than 2 seconds, continue to the mental status assessment. Assess the mental status of a patient by asking a simple question that is easily identifiable, such as, "Where are you?" or "What year is it?" If the patient appears to be suffering from an altered mental status, or AMS, such as confusion or disorientation, classify the patient as a priority 1 or red. If the patient successfully passes all 3 stages of an RPM assessment, classify the patient as priority 2 or yellow. Perform secondary triage. Secondary triage can be performed when more personnel arrive at the incident scene. During the secondary triage, patients are separated and assigned to treatment groups based on their priority level. This stage of triage is important to ensure that patients are treated and transported according to their priority. In this stage, it might be necessary to recategorize the patients depending on their condition worsening or improving. Initiate treatment with supplies and equipment from the ambulances, such as bandages, blood pressure cuffs, and oxygen. Transport patients. Patients can be transported to the appropriate facility once they have been properly assessed, triaged, and initial treatment has been performed. Transport units will pick up the patients in order of severity. The priority 1 patients will be transported first, followed by the priority 2 patients, and then the priority 3 patients. All priority 0 and deceased patients will be removed from the scene last. Perform a detailed physical exam. A more detailed assessment should be performed during the patient transport. The purpose of this assessment is to gather more information on the patient's condition and injuries. You may expose the patient to inspect the head, neck, chest, abdomen, pelvis, extremities, and posterior of the body, as well as examine the facial structures, ears, nose, and mouth. Performing a detailed physical exam is important, but treating life-threatening problems is paramount.